Okay, well, we will go ahead and get started and we'll see who jumps in. But hi, everyone. I am Annalise Cothran. I use she, her pronouns. And I would invite all of you, if you are able to and willing to, put your pronouns on your screen as part of our best practices for supporting LGBTQIA people. The security function should be such that you're able to change that on your screen. And to do that is just hovering over your picture in Zoom, pressing the three dots at the top, and then just adding your personal pronouns there. So today we're going to be focusing on policy action for LGBTQIA oral health. And I don't have any conflicts of interest to disclose, nor do any of the other presenters for this workshop. So we're going to talk about three things today predominantly, which is to provide a policy update on kind of the status of LGBTQIA health nationally, and then talk about some state level strategies for supporting LGBTQIA plus health. And then the third thing we'll talk about is the Equality Act, and we'll kind of go through the toolkit that was developed to be able to source some advocacy strategies there. So first up, our national policy updates. It's actually bad. It is very, very bad. I wish I could say anything different, but it has officially, from all accounts that I'm understanding, the 2020-2021 legislative cycle has been pretty historic, and not just not passing protective legislation, but actively attacking LGBTQ plus people, predominantly transgender people, and predominantly transgender children. So this has been a trend that we've seen nationally in almost every state, and it's been pretty horrifying. So 30 plus states offered some form of anti-LGBTQ plus bills. Again, most of them were focused on transgender children. Collectively, those 30 plus states offered hundreds of bills and or amendments on existing bills that were actively attacking the rights of LGBTQ plus people. So they focused on banning transition care for transgender children, banning children from playing school sports, and even going as far as in Texas, where I live, attempting to change the code such that parents who allowed their children to access medical care, their transgender children access medical care, would be prosecuted as child abusers and potentially making their children go into foster care. So we're talking about very draconian, very oppressive attempts on oppressing transgender people. But there were also bills like religious liberty bills, quote unquote religious liberty bills, that essentially would allow providers to refuse care or treatment based on religious ideation, and that would disproportionately impact LGBTQ plus people. So there were lots of attempts. I am happy and pleased to report that a lot of these attempts were completely foiled in most states. Unfortunately, several states passed very oppressive laws for LGBTQ plus people. And again, predominantly focusing on transgender children. And so these are the 7 states that successfully passed some of these really terrible laws. The ones that have the red stethoscope passed some sort of healthcare bill, essentially banning access to transition care for minors. There were several states that passed sports bills, which banned transgender children from participating in sports in public schools. So I believe that also extended not just to children, but also university students and anyone who was sort of attempting to engage in athletics as a transgender person. The states in green, Montana and Arkansas, essentially banned the ability to change your birth certificate or to amend any of your legal documents to, your name, your authentic name, if you are a transgender person. And then Tennessee and Montana also passed some really bad infrastructure bills that related to education and being able to talk about what transgender is, what that means. And so there are a lot of oppressive laws that actually did make it through in many states. So one of the most oppressive and draconian laws that made it through was here in Tennessee. So this was part of an amendment that was tacked on to HB 1182, which basically is now forcing any public facilities in that state, anyone that has a public restroom, any entity that has a public restroom has to provide a notice saying that a transgender person may be using the restroom next to you. So I bring this up because this is real. I don't think a lot of people who are following this closely recognize how evil this legislation has gotten. And it's literally othering transgender people. I mean, to the point of where we're thinking about back in the Civil Rights Day when we weren't allowing Black people to drink water fountains the same as white people. Like, this is the kind of stuff that same type of very segmented oppressive thinking that's now being aimed at the LGBTQIA population. So it's very real, and the effects of this policy is incredibly harmful. And so why this is happening, I thought it might be a good idea to actually spend some time talking about how we got here. Because I think it's really easy to be shocked and outraged when we see these things. But when you actually look back on how policy has led up to this point, it makes a lot of sense. And it really harkens our call to say we need to do something now before it gets worse, because we've seen it get progressively worse every year. Really aiming all of this toward transgender people, but also LGBTQIA, the entire community. And I'm just going to say, for the purposes of this presentation, I'll sort of reference the LGBTQIA plus community as the queer community, since that's just a little bit easier for me to say as I'm talking fast through this. So essentially, I think it makes sense for us to talk about how we got here. And the easiest way to put this is that there are particular organizations in power that are incredibly well funded. And because they are incredibly well funded, they have had the ability to pinpoint pieces of essentially culture wars or wedge issues that make people feel uncomfortable, or maybe people don't know enough about, and they can take that and really weaponize it and leverage, which is what they've done with this entire transgender issue. So the Heritage Foundation, the Family Policy Alliance, and the Alliance Defending Freedom are sort of in a group together. They are basically conservative think tanks. The Heritage Foundation is actually a nonprofit. They are heavily funded through dark money, which means that it's very hard to trace who is giving to these particular organizations, and that's done on purpose. And basically, they have taken their huge financial resources and invested that in marketing. And this article that I'm showing from the Rolling Stone is a great one. If you really want to delve into the history and how we got here, this article details how this issue was developed. And basically, it was through market testing. So they tested this in a few different states, and they found that they sort of got a boost in ratings or numbers or support for conservative values when they introduced these transgender issues. And so now these three organizations have developed this fourth box, which is the Promise for America's Children. And if you look at their marketing, it's pretty stellar. It looks like it's trying to support diverse children. They even talk about transgender issues on this, and it's all a cover for promoting hate legislation. And so what you can actually do is go to this Promise to America's Children website if you are a legislator in any state, and you just send them your information and they'll give you template language. So that's why these bills have been so popular, is that they've essentially been copied and pasted into 30 plus states with minimal effort from legislators, because they already have the template language in front of them. And so that's why it's essentially been a coordinated attack on LGBTQIA people or queer people, particularly transgender children. And they've picked this issue because it's an issue that maybe people don't know a lot about. And so they've sort of been proactive in changing the narrative. A lot of times they drive conversations like you're cutting off children's genitals, you're mutilating their genitals, you're making them sterile before they can be an adult. And there's just like a lot of misconceptions, and they choose this very shocking language purposefully because they've message tested it and they know that it confuses and scares people, and they're more likely to get support when they promote things like that. And so I think it's important to actually talk about who is driving this conversation and why, and how easily they now have the landscape and the conversation in their hands, because they've done so much effort. They've put a lot of effort and money into getting us to this really fearful point, and it's working. And they also have these national partners. And again, I think it's important to just name this and highlight it, because these are the people that show up in every state when they have committee hearings, when they have policy discussion. These are the groups that they reach out to show up. The American College of Pediatricians is one in particular that is, again, named as a hate group by the Southern Poverty Law Center, but they show up looking very credible. And that's because they are an offshoot of the American Academy of Pediatricians, so AAP. And AAP is thousands and thousands and thousands, like, 40,000 pediatricians throughout the entire nation. And ACP is about 500 pediatricians. And they were an offshoot of AAP because they got kicked out for essentially not practicing medically necessary standard best practice care, right? They're advocating basically hateful care through medicine. But they show up to committee hearings in every state. They look very credible because they're pediatricians, and they talk about all of these really, they misrepresent the science, and they scare people, and they do that purposefully because they're, again, promoting this larger agenda. They're paid by those organizations that we saw here. They're all sort of funded through this. There is one for dentists too, but I couldn't find that one. And again, I just think it's important to know that there are these organizations that look really credible. They are full of health professionals who will just go up and misrepresent the science in the name of advancing hateful legislation against queer people. So because we know this is going on, it's really important for us to engage in advocacy strategies. And so I'm happy to talk a little bit about what we have done in Texas and some of our success. I can say of the 30 plus bills and something like 17 amendments that were offered during this regular session, we were successful in defeating all of them. And so I'm really excited to just promote that sometimes it can work, and just some opportunities to engage in strategies at the state level. So I'm putting 4 up here because we also recognize that every state is sort of dependent upon the culture of your legislators, of sort of your network of advocates. Sometimes it's really difficult to advise on specific strategies within a state, but I'm throwing 4 up here that I think you could probably apply anywhere. And the first one is maintain visibility to apply pressure. And that's one thing that we're talking about with the Quality Act Toolkit, is that you are probably not there to change hearts and minds. It's likely that the inside game has already gone partisan, and you're probably not going to really switch somebody unless you can give them political coverage, unless you can do these really big shows of visibility to say, okay, I think I have enough political coverage to maybe vote one way or another. The picture that you have here on the screen is from a demonstration that we actually did in Texas, where parents of transgender children came and lined the Capitol before they were set to vote on SB 29, which was our sports bill that that would have banned transgender kids from playing sports. So all of these parents lined up talking about what their children deserved, what their transgender children deserved. A lot of them said love, peace, happiness. Hundreds showed up with these signs. And then one woman, I don't know if you can see where I'm highlighting on my screen, but she came and played her violin. And she played like the national anthem. She played Deep in the Heart of Texas, because we all said we're patriots too, right? We're here to protect children. And so she played her violin, and we stood there in this very peaceful protest, to support transgender children. And so these huge shows of visibility can be really important and can make a difference, which is one strategy I would suggest. Number 2 is engaging diverse advocates. And that's because I think all of the different voices saying the same message, you never know which messenger is going to resonate most with a legislator. And so sometimes there are non-traditional stakeholders that you wouldn't even consider who want to be involved in these issues. So specific to Texas, we engaged a lot with the business community. In Texas, basically businesses and corporations run everything. And that's not specific to Texas. A lot of conservative states really want to promote business, really want to promote the economy. And so we had a lot of businesses stand up and say, you are decreasing our ability to recruit and retain workforce here in Texas by trying to pass these discriminatory policies. You know, from a purely business perspective, this is not helpful for maintaining a thriving workforce, and you're cutting into my economic prosperity. On the same token, for instance, with the bathroom bill in 2017, Texas Impact, of which I'm a board member, we bussed in faith leaders from every part of Texas. Like, we literally hired charter buses to bring people in wearing their full garb of all different types of faith traditions. And they stood on the steps of the Texas Capitol, and they openly prayed for legislators to stop discriminating against transgender people and not pass the bathroom bill. And there was not a Texas legislator who was going to go against a whole group of faith leaders saying, stop discriminating. I'm praying for you. I'm praying for you to stop. So that was super effective, right? And so those are some advocacy strategies that you can probably apply anywhere to all types of different types of advocacy organizations. And then number 3, my favorite one is just follow the money. There are lots of websites now that have made it way easy to see who is donating to whom, including PAC money. PAC money can get kind of difficult to follow purposefully, but I can give you an example of a legislator who there was a specific legislator in Texas who we thought we could influence. And so we kind of went on Transparency USA, that's where I go. And we saw that he was really heavily funded by the real estate PAC here in Texas. Well, among our group of advocates, we have 4 or 5 different real estate agents. And so they called that PAC saying, I give money to you guys every year whenever I fill out my real estate license, and you're actually promoting discrimination. And I don't agree with that. And so sometimes you can actually leverage by saying, please tell them you won't fund them again. And you never know what you may have connections to. So I find that most legislators, regardless of their political affiliation, are willing to at least consider whether or not donations will be pulled from their political campaigns. And then number 4, I love this value-based messaging, and I'm going to promote Families USA here because they have a really wonderful value-based messaging packet that they put together. I think it was last year, maybe it was earlier this year, and it was specific to health policy and talking about the commonalities of values between Democrats and Republicans. And how there are a lot of similarities. And so leveraging similar values toward a common goal can be really helpful. An example of this that I used during our legislative session in Texas is that I am the wife of a retired military person. My husband is a Purple Heart veteran, and Texas is like military state USA. And so when I would go and talk to legislators, I would say, you are basically hindering my child's ability to access military medicine. You're affecting the military community, and I'm proof of that. And so sometimes those common messages can be really effective because they, again, help give that political coverage to a legislator who may not be considering your particular community. And so that can be applied a lot of different places. And I just would redirect you to Families USA for a more in-depth look there. So I know there's only a few of us, but I'm really interested in hearing about what types of advocacy that you may be working on in your state in relation to LGBTQIA, to the queer community. If there is, any policies that you guys have advocated for, either successfully or unsuccessfully, I'm really interested in kind of hearing from the group if there's any feedback or stories that you'd like to share. Or you can always chat them in. And yes, Geraldine, I'm sorry, you are going to get this information later.
Thank you, Annalise. Well, I want to say something. The reason I joined is because I know the work that you're doing with this group, and I'm just like surprised. Well, or not maybe surprised, but it is so sad, that this is happening. And regardless of whatever it is, they're humans, and they deserved, someone that can fight for them. So I don't know, I was just thinking, and I'm like, wow, I think they find someone who's going to fight for them too, because it's just sad.
Yeah, and that's actually not uncommon. I mean, even here in Texas, there are so many times where I would share like all of the bad bills that were coming through, and people would just say, I can't believe this is happening. Like, I haven't heard anything about it, which I think it's really important for us to continue to have conversations like this, because a lot of people, particularly people who are cisgender, who are heterosexual, who have all of those layers of privilege and don't have to sort of actively engage in fighting for their own civil liberties, don't really know what's going on. And so I think that's why this is really important to maintain this visibility and keep amplifying the policies that we're seeing.
Yeah, I feel like we, as a community of oral health, we have all focused in adults, elderly, younger kids, and now this is a new reality. I guess we need to put our eyes here and help you as a leader, and support this group and help them and be a voice, because that's the other problem that we're fighting. These people are like, secluded, they're like, they don't want to talk, they don't want to fight. There's some that it's intimidation and rejection, and they fight with so many emotions, that I guess as leaders, we should help them. This is great. Gosh, it's an eye opener for me.
Yeah, thank you for saying that.
Yeah, great job, Annalise.
Is there any other, we have more to share, but I wanted to pause here for any reflections or comments or whatever the group would like to talk about. We're small enough that we have some time.
And now if we're interested in helping or in advocating, I guess we'll be in contact with you. I know you and I share our group, once a month, but if we are more into focusing in this type of group, you'll just give us some information, or
Yeah, we're going to actually review a toolkit that we put together for advocacy around the Equality Act. And that's nationally. So that's definitely something that you can do with other open members, because it's just really specific to your senators. And however, I think there are lots of opportunities to advocate on the state level too. And my biggest recommendation is to connect with the advocacy organizations that exist in your state, because they're everywhere. Yeah. I know personally, I do a lot of work with Equality Texas, but the Equality Federation exists everywhere. So there's probably like an Equality North Carolina, et cetera. And also the Human Rights Campaign, they usually have offsets within each state too. And my experience, and I don't know if anybody else wants to jump in here, but my experience is that those people have been doing that work for so long. They really know all the ins and the outs and the culture of your state legislation. And so they are usually the ones who can best direct kind of the grassroots, boots on the ground efforts, because they know which legislators are going to be the ones you should be making phone calls to, and why, and what messaging may work with them, et cetera.
So I guess we have sort of good support and documentation and advocacy, maybe tools that we can use to start
Yeah,
advancing
absolutely.
this equality issue.
Yeah, and maybe it's a good time to transition into talking about the toolkit. And these slides will be made available to everybody. So if you want to use them as a resource, you absolutely can. But we also have a toolkit too that you can has some very easy steps that you can engage in advocacy to.
Okay.
And so I think thank you for bringing this up, because I think it really talks about why we need the Equality Act. So all of these state level attacks on queer people, a lot of them have the ability to be sort of circumvented by really solid federal legislation. It sends a messages to states, like if you're going to pass discriminatory policies, they can get easily overturned by having a federal policy in place that strengthens protections against the queer community. And one of those is the Equality Act. So I think it's important to talk about what some of the results have been for the LGBTQ plus community, and talk about where the policy landscape is right now on a national level. So number one, we have seen some improvements here around people who are non-heterosexual and protections for them, which is based on sexual orientation. So we have very few, quote unquote, negative, meaning very discriminatory policies for non-heterosexual folks. And we have a lot of high protection policies, which is great. I like to remind people, because sometimes you get comments like, almost in the same vein as like us being post-racial as a society. Sometimes we think like, well, we're post-gay discrimination, and that's not true. I mean, it's only been 6 years since gay people had the right to get married. Like, I mean, this is just crazy. And just because people are now putting up pride logos and putting their logos with the rainbow doesn't mean they're actually doing anything to help the queer community. And so this is a source of frustration for me, and why I want to point it out that there are lots of states that still discriminate against people for being gay, even though we've seen a lot of support around non-heterosexual acceptance or whatever or affirmation, however you want to frame that. There are still many states who refuse to protect sexual orientation. But when we look at gender identity, I mean, the board shifts tremendously here, right? So we see tons of states that not only don't have protections, they actually have policies in place that negatively impact people who are non-cisgender. So that would be anyone who doesn't identify with the sex that they were assigned at birth, or the gender that they were assigned at birth. And so we see that there are some states that are really doing well and that they have high protection policies, but many states do not. More than half of the states either have negative or low protection policies. And so support like the Equality Act can help regulate some of that and sort of circumvent what states may do to pass or put in place these really discriminatory policies. And so these policies, we see a direct connection on the health and well-being of the queer community, and that they are disproportionately affected from experiencing homelessness, from LGBTQ youth are overrepresented in foster care. We also know that particularly for transgender people and sort of the whole spectrum of gender diversity, that policies like this and even conversations that we have about whether or not transgender people have human dignity and worth in our country leads to these very psychologically distressing outcomes. I mean, I think that's the biggest thing that I talk to legislators about in Texas is like just the fact that I have to come here and talk to you about whether or not a transgender person matters in Texas. The damage is done. The conversation has been had. And so it's really alarming that we see this pattern of, suicidal ideation about transgender people not even wanting to use a public restroom, regardless of whether or not they actually have a policy in place, like a bathroom bill policy in place. They're terrified to do that because of the discrimination and the violence that they would likely receive because of the conversations around that. So that's, we've seen a huge trend here, sort of attacking transgender people, but I do want to highlight that the Biden administration has done a lot since coming into power in January. They really have done a lot to protect transgender people in the ways that they can. So number one, I think within the first 100 days, the ban that was put on transgender people participating in the military, that was rolled back pretty immediately. And that was supported by all kinds of military leaders too. I mean, I did not see any public leaders saying, yes, please discriminate against transgender people in the military. And which was why the support for taking it back, there was a lot of support there. But more recently, we've also seen that Biden released, I believe, an executive order about healthcare discrimination, such that if a entity receives federal funding, they cannot legally discriminate against transgender people. So for me as a military member, accessing military healthcare, whenever I would talk to legislators, I would say, you know, my child, if they want to receive transition care, they can go through on a military base and it's considered medically necessary standard care, no issues here. And I think even now, and Colin, you can correct me if this is true or not, but I think if you even accept Medicaid, because that's a federally funded program, that as an entity, you also cannot reject care for transgender, LGBTQ or queer people. So that actually did a lot to protect us in terms of healthcare discrimination. And then even more recently, Title IX, basically the Biden administration released what they called an interpretation of Title IX, meaning that they believed protections extended to transgender athletes. And so that wasn't necessarily a law. They just kind of said, this is how we're interpreting the law, which does make it a lot more difficult that if you want to enable a state policy, it is easier now to get overturned through a lawsuit because you say, well, you're breaking Title IX, right? So there's been some bright spots, and I think this is a good thing to remember that there are people at the federal level who want to see protections for the queer community and are actively doing work to ensure that happens. And so that's why the Equality Act is an important piece of advocacy legislation that we should be focusing on, because it just strengthens protections for people based on sexual orientation and gender identity. And so we kind of put together some talking points about how and why this is important to oral health. And again, as oral health equity champions, we should really be thinking about oral health in all policies, kind of the same thing as health in all policies, oral health in all policies. If we really want to focus on the social determinants of health and the drivers of inequity, we have to look to things like legislation to protect against discrimination. And so number one, sort of the first talking point that we're offering to the community is that the current protections are not working. I mean, I just presented even a fraction of the data available saying that we see these really profound health outcomes for the queer community because they have the legal ability to be discriminated against. And that leads to more than 15% of queer people not wanting to get medically necessary care because they're scared to do so. And even more alarming is that we do have healthcare providers who will openly and actively admit they will not treat transgender people. And so this would actually strengthen protections, saying, you know, there are some states, again, in Texas, for one, there was a bill put together saying that you could discriminate against basically any patient for a religious ideology. And that disproportionately impacts the queer community. If you don't believe somebody should be gay or you don't believe somebody should be transgender, then there are protections in place who would say you could legally discriminate against them. And so I think there is a need here to pass the Equality Act because there is still active discrimination and people are being really blunt about it. Number two, we know that when people have discrimination, protection from discrimination, they're more comfortable actually accessing healthcare. And we as oral health equity advocates, we know it's not just about giving people insurance. We know that this is also about ensuring that they can access and utilize the healthcare that they may, that they have, you know, insurance coverage for. And so just even getting the first step out of the door to get to your oral health care provider can feel really challenging, particularly if you know that you could be discriminated against as a patient. And so legislation like the Equality Act can signal to queer people that the federal government is sort of on their side and giving them that discrimination protection, and hopefully can help them overcome those fears and of being stigmatized or discriminated against. And then number three, is that, again, sort of harkening back to those arguments around social determinants of health, influencers like stress and trauma can impact our overall health, including our oral health. And we've seen this over and over again. When you're living in chronic fear and anxiety of being discriminated against, or even, threats of violence, like this is a very real, this is a reality for the queer community. And so the Equality Act can really reduce those social risk factors that do disproportionately impact our overall health, including our oral health. So Colin, is it okay if I throw it over to you? And I'm happy to share my screen, and I'll just mute myself. And we can talk about this toolkit that we've developed for the oral health community. And we can kind of go through any questions that you guys have after Colin introduces it. Does that work?
Sure. Yeah, and I'll just add, to some of Annalise's content, just to kind of emphasize why this is important. She mentioned that, the Biden administration did revive some federal protections when it comes to federally funded health programs for LGBTQIA plus people, among other populations. And those were protections that were put in place by the Affordable Care Act. But in 2019, the Trump administration did away with those protections. And so, we have no guarantee moving forward that we're always going to be under a favorable presidential administration. And so if we continue to rely simply on federal regulations, those can be undone again. And that's really why we need to pursue additional legislative strategies to protect people. The other thing I'll mention is that, with regard to the social determinants of health and their interactions with oral health, we heard that many in this community, especially transgender youth, are seeing rises in suicidal ideation and suicide itself. We also know that that poor oral health can contribute to depressive conditions and suicidal thoughts, especially among adolescents. So, not feeling comfortable accessing the care you need to address those problems can compound some of these existing, effects of discriminatory policies. So all these things are really wrapped up in one another. So all that said, Annalise has really just done an incredible job in pulling together an advocacy toolkit on this issue that not only lays out much of the information that she's covered here, but provides you with effectively everything you need in order to raise this issue with federal policymakers, especially. As she said, right now is the time that we need to be going to members of the Senate to ensure that this is passed. It's possible that this could be voted on in the next week or so. So this is really, this is something that needs action now. And so, we've got messaging tips in here, information on how to actually go about contacting your legislators. There's information on some of the partner organizations like the Human Rights Campaign, information that they've pulled together on the Equality Act. And Open itself has some additional resources that can help you do that direct outreach that needs to happen now to members of Congress. And that includes the congressional engagement matrix that Pat Finnerty has done a great job of maintaining for us over the years. Annalise, did you want to walk through the actual toolkit itself here?
Yeah, happy to do that. I think the one thing I do want to point out here, and it's probably good for a follow-up email that I would suggest, at least that's what I did in my advocacy meetings, was pointing people back to the AIDPH Resource Center that has a ton of research. I don't know if anybody's actually going to go to it, but I think it's helpful to know that we are talking about evidence-based strategies. We're not just kind of pulling these figures out of the air, that this is from research from oral health researchers, right? And also a lot of the research that was compiled, at least in part and in pieces, was done through the LGBTQIA NRT, which I would invite anybody to come and check out our monthly meetings. So any resources that we were able to find on education, we threw into this database as well. And so that's a great place to give just a follow-up email and say, let me direct you here. But this is an email to your senators. Again, it has already passed in the House. So we're focusing all advocacy strategies on just senators. And Colin, there was an interesting question brought up in the last meeting in the Medicaid meeting about should we, if we have a Republican senator and they may or may not, probably not, will vote for this, is it still important to talk to them? Do you have any thoughts about that?
Yes, I do. I think the short answer is absolutely yes, it is important to talk to them. For one, I think it's always worth taking the chance that you can appeal to them through some of the values-based communication strategies that Annalise mentioned earlier, that aren't, simply saying do the right thing, but saying rather, we're the same, we value the same things, and that's why I'm asking you to take this action. But the other thing is that it's always important for us to show just how many people care about an issue. It's critical, especially, that we can show that there are people in a senator or congressperson's state who are calling for this to happen, because at the end of the day, you're the people who are going to vote them in or out come the next election. So even if it's not something that they feel compelled to do or that they believe in, if there is an overwhelming call for them to do something, and they have a sense that, that might be something that is a deciding factor in the next election, they may just be pushed over the line to do it.
Yeah, and I'll add too, again, in Texas, we have very conservative senators. And I can tell you that meeting with their staff members, because I've done this now through Open so many times, like we've done our Hill days, and I've been able to meet with them in person, but then also via Zoom now. And so I've actually been able to develop a relationship with a lot of these staff members. We almost never agree at the end of the day, but now when I do send them an email, I can usually get a meeting within a couple of days because they recognize who I am. We're probably going to walk away with that meeting from a different, in a difference of opinion. I haven't heard a yes on this from either of my senators, but I think that they recognize there are people that are willing to keep them accountable and just willing to talk to them about oral health. And also, if I really do have something that is a good, solid, bipartisan piece of legislation in the future, I have a way better chance of advancing that on behalf of oral health by maintaining those relationships and really building them in a fruitful way.
I agree.
So Colin, maybe you can talk about some of these tips for advocacy, because I know this is something that you guys talk a lot about in the policy NRT, and I think it's really helpful maybe to just reiterate how you would suggest approaching a meeting if somebody would like to.
Yeah, I mean, I think for one, I know a lot of us, when asked to take action to contact our members of Congress or our senators, we maybe have some hesitation about, wait, what, can I do this? Is this lobbying? Am I allowed to advocate in this way? And the fact of the matter is, in most cases, the answer is probably yes. Private citizens and members of 501c3s can in fact advocate in this way. If you're a federal state employee, that may be different. There are legislative restrictions there, in the form of things like the Hatch Act for federal employees. But for the most part, when we look across the members of Open, I would say that the vast majority of people are in a position where they can, in fact, advocate in this way. So, I think, the other thing that comes up is, well, what if I get, asked questions about X, Y, or Z? Pushback on certain issues. Annalise, I know that you have some good examples of exactly the kind of pushback that you've gotten on this, so I'll give you a chance to talk about that in a second. But I think, the strategy that I often resort to is a little bit of a, an acknowledgement and a redirect, especially back to that issue of, values-based messaging, and saying, yeah, I understand your concern here, but at the end of the day, what we're talking about is ensuring that everyone is able to get the care they need to be healthy, happy, productive, and tailoring that message a little bit based on what you know about that particular policymaker. So you do want to make sure that you've got a little bit of an elevator pitch to go into that meeting with. Oh, and first I'll just say, in terms of getting the meeting, I think it's easier now than it's ever been to get a meeting with legislators, especially members of Congress. They're all used to doing virtual meetings and phone calls now. It used to be that you had to set up a time to actually meet in person, and that scheduling was typically pretty difficult. Nowadays, I would say your best course of action is to start with an email, give a quick overview of why you want to talk to them, and ask very explicitly, can we set up a time for a call or a Zoom meeting with you? And 9 times out of 10, you'll get a yes. If you don't, then resort to a phone call, either to their DC office or their state office. And again, that information can be found in the congressional engagement matrix. So once you do have a meeting set up, make sure that you've got an elevator pitch prepared. I find that it helps to rehearse it a little bit, in the mirror or over the phone with a friend or colleague. You want to make it quick. At the end of the day, a lot of these folks have a lot of meetings on their plate. I would say, budget 10-15 minutes tops for this kind of meeting, and expect that they may say, hey, I've got another call in 5 minutes, because that sometimes happens. So you don't want to be caught off guard by the fact that they're going to rush you out the door. So make sure that you've got something prepared that's short, sweet, to the point, and has an ask. Make sure that you if you leave them with one thing, it's the action that you want them to take. And again, incorporate a couple of facts that you find compelling. Even better are personal stories from people in their state. I talked with so-and-so who, has a son, a daughter, a child, a mother, a sister who is experiencing this, and here's how you can help them. Like, here's how that affects their day-to-day life. And then always offer to be a resource to them. I think that just, shows that you're coming to this from a collaborative standpoint, and you're willing to, help them address a broad range of issues moving forward. As Annalise said, part of this is about establishing and building that relationship with policymakers and their staff. It's rare that you'll get a meeting with a member themselves. So, you're probably not going to have a sit down or a face-to-face via Zoom with your senator. If you do, that's fantastic. I mean, that will be amazing, and that occasionally happens, but more often than not, you're going to be talking to a staff member who.
Sometimes you find them in the hallway and you assault them and force them to have a meeting.
Absolutely, yeah. If you're in person, and you see them in the hallway, you should not hesitate. I mean, at the end of the day, they work for you. And sometimes these meetings are going to be very one-sided. I mean, that's just the fact of the matter. Sometimes you're going to have a staff person who sits pretty much silently. Maybe they'll nod, but they may not really give you much of a reaction at the end of your pitch. Again, that's just sometimes the way it goes. I think a good strategy there is just to, put them on the spot a little bit and say, can I count on you to do this? Can I count on you to have this conversation with your boss? And most people are responsive to that, if only because you put the pressure on a little bit, and they want to show that they're doing their job. Sometimes they're going to be late too. I've had situations where I've set up meetings with congressional staff and they're 10-15 minutes late. They had a vote, so be prepared for that. But again, I think persistence is key. Making sure that you're leaving them with a clear ask is key. And again, appealing to, to common values is a really great strategy here.
So there's also this part here with social media messages, which is just kind of copying and pasting from other organizations. I think the messages are similar for any health advocate, oral health advocate, or just advocate in general. So we sort of suggested just using what campaigns are already there and folding into those existing national campaigns. And I'm going to put this in the chat so that everybody has access to it. If I can figure that out without being able to see the rest of my screen.
Or you can send it in an email on Elise too.
Okay, sure.
Yeah.
Oh, here we go. Okay. And I think if it's okay, if you guys have questions, we have like about 5 minutes left. So if you guys are interested in talking about specific strategies.
I don't have questions. I just have some reflections about all this, I think it's all about, we always say that it takes multiple times to understand or to get a message across, and the other thing is that I think the key here is, well, let's don't focus on the I don't want to say racial aspect, but it's like this group, but just focus on what they need, their health. That is only what we're asking, so I don't know.
Yeah, I think you're right, Geraldine. I think at the end of the day, we're just saying, please just treat people equally. Like every person, regardless of sexual orientation and gender identity,
doesn't matter. Yeah,
we all deserve the same things.
You were Colin, you were saying on the phone, like, okay, well, we're just fighting for people that they just want to be healthy. And then not only that, it's not only health, but everything that is, the whole social determinants, of health, what they struggle with, all the emotional part, all the frustration, the fear, the rejection. I mean, this.
Yeah. Well, I'm glad this has been helpful. And I really hope that maybe you can take something away from this and engage in some advocacy strategies. I know it's critically important right now. Again, even if you're not changing minds, like Colin said, you're really there to say oral health is paying attention to you. And we're going to continue to do that because we care about all of our communities, right?
Yeah. So this is good. This is really good.
So I think Josh is tapping me to send people back to the main session. So I put the link to the toolkit and the slides in the chat. I hope that's helpful. And please feel free to connect with either me or Colin. You can get our emails, I think, from Visiboo, or send us anything that you need. But I think either one of us, I'll speak for Colin to say that we're both happy to connect if needed.
Yeah, no wrong door.
And if you can, Annalise, just send this information by email, please.
Yes, if I do have access to everybody's emails, I certainly will.
Thank you, guys. Good job.
Okay, thanks everyone.